Thank you so much. So we'll bring the other two panelists in now that we've heard from Peg, and we'll bring in both Rachele, do you want to start and introduce yourself and who you are and what you do?
Sure. My name is Rachele DeCrescenzo. I'm a physical therapist, and I have a practice in Clinton. It's called The Healing Journey, Myofascial Release and Physical Therapy. So I focus more on kind of non-traditional physical therapy. I've been a physical therapist for 17 years, but my practice now focuses on myofascial release, which is a very holistic, hands-on, whole body, mind, body, spirit type of treatment that really focuses on getting to the root of the problem rather than just putting Band-Aids on the problem. Really tries to get to the root of the symptoms. But today I'm really speaking more as a mom. I have a 9-month-old and I have a 6.5-year-old. So yeah, Dennis, was there a specific question you wanted?
Well, yeah, we'll start asking the questions, but I just wanted everyone to get an understanding of who you are, and then we'll bring in Carolyn as well. So Carolyn, you want to introduce yourself, who you are, and what you do, and then we'll address 2 or 3 simple questions.
Hi, my name is Carolyn Flynn. I'm the director of the START program at the Center for Great Expectations. We provide in-home services for pregnant and parenting persons with trauma and substance use. And I'm also an early relational health specialist at the Center for Great Expectations, including the START program. I'm a licensed counselor and rostered in child-parent psychotherapy.
Excellent, excellent. So first and foremost, it's wonderful to know that these type of resources are local here in Central New Jersey to begin with. I mean, we have some pretty powerful people here on this line, which is pretty impressive. So as far as going through, before everything started, before the pandemic, we're going to talk a little bit about what life was like in your respective roles before the pandemic. And then if we can go on after the and then we'll follow up with what it's like now. So we'll start there. So let's start with Rachele first. Do you want to go into a little bit about, how the pandemic has changed, obviously as a mom and your business a little bit? I know you have ability to work with pregnant women, moms, different people. How have you found that your clients and yourself were before the pandemic, and then what's it like now?
Yeah, I mean, I'll speak more really, I guess, about my me as a mom, and from that perspective, I mean, my practice is my current practice is still fairly new, so I don't have and I didn't work a lot with children prior. So but as a mom, things have obviously definitely changed a lot. I mean, just from, like I said, I have a 9-month-old and a 6.5-year-old. So just the pregnancy, the labor, was so different between the two children. I mean, with my 6-year-old, it was kind of the standard. You go to the hospital and people come visit, and you're there for a few days and people can come and go, and it was kind of your standard delivery. Whereas with my son, it was during the pandemic. He was born in May, so just completely different hospital experience. I gave birth to him at Hunterdon Medical, and they were wonderful, but very different experience. My husband was allowed to come in, which was obviously wonderful. I can't imagine doing it without him. But there was talk right at the beginning of the pandemic that they weren't going to allow support people to come in because of so many unknowns, and that was very disconcerting to me. Having already have gone through it and just knowing the importance of having my husband there, the fact that he may not have been able to come was very scary. But he was able to come, but he was the only visitor. Once we were in, we were in. He wasn't allowed to leave. We weren't even allowed to leave our rooms. I gave birth in one room, and then once we were ready to move to the other room, we moved together, and that's where we stayed. If we needed anything, we asked the nurses. So very different experience. In some ways, it was kind of nice not to have so many visitors in and out, actually, and just to be me and my husband. But I would have obviously loved for my daughter to come to the hospital. I think her coming home to me and my husband already being here with the baby was difficult on her. I think she's being 6 years old. It's already hard to bring in a baby to the family. And then when we came home and we were already here, and then she had to come in the house, I think that was difficult for her. And then just, having him, it's been a very different experience. I really don't take him anywhere except for he's in the car every once in a while, but I'm very careful about bringing him in supermarket or stores, just because he can't wear a mask, he can't really protect himself. So it's just been a very different experience. He's not getting the same types of interactions even with family. We're being, we're seeing some family, but being careful. So very different experience, from my daughter to my son as far as parenting.
Understood. Would you want to go, Carolyn, as far as explaining a little bit about, first, I think we're going to need to learn a little bit more about what it is you do prior to COVID, and then we can talk about how that changed.
Sure. So the START program is only one of many programs across the continuum of care at CGE. I'll speak directly to the experience of the providers at START and the families at START, since I know that most intimately. So START offers 3 services in our clients' homes. We are designed to overcome the barriers to recovery for pregnant and parenting persons. So we think about the many barriers to attending treatment where mom and baby might be separated, difficulties with transportation, if parents have childcare, these are all barriers. So we bring our services to our clients, and we offer early relational health treatment. So this is an integrated model of attachment-based therapies where we're looking at the patterns of intergenerational trauma and relational impairments combined with substance use treatment. So the intersection of trauma and substance use on the relationship between mom and baby. We also have an integrated doula case manager. So this is someone who is providing birth education, support at the hospital, really mothering the mother during postpartum, and then helping with access to all social determinants of health, where we know that in order to focus on trauma and treatment, an individual does need to have food security, safe housing, safe relationships. So really providing that foundation. And then lastly, peer recovery support from a certified peer recovery specialist who has been through recovery themselves and can offer that different perspective. So prior to COVID-19, one of the most wonderful things about in-home work is that we have such an intimate setting and so much context around our clients. We're coming into their home, we can get the feeling for what life is like for them on a day-to-day basis. And we've moved from that to really needing to adapt in terms of doing walk and talks in the park rather than being in the client's home, or using telehealth, so using video chat or having phone sessions. So this invites both challenges and opportunities for our providers, but we've adapted in some really unique ways to shifting to meet our clients' needs. For example, while we often can't provide transportation, if that is unsafe due to proximity, we have been able to bring food to our clients' homes, to bring diapers, to bring formula. So we've really just pivoted and adapted to where our clients are at.
Excellent, excellent. So as far as I know, and then we'll come back to Rachele, as far as the interesting piece before we started the videos, you were mentioning that a heavy data aspect to your role and to your business. Can you get into that a little bit more detail for us?
Absolutely. So in all of our programs across the continuum of care, we realize that there are many different ways that we can measure progress that our clients are making, or whether our programs are being effective. And it's important to look not only at the client's perspective, the provider's perspective, but also outcomes based on data. So at START, our clients complete at intake every 6 months of treatment throughout their 18 months with us, and then at discharge, a whole series of clinical assessments. We do an index regarding PTSD symptoms. We do assessments around anxiety, depression, parenting stress, and even something called the working model of the child interview, where we're really looking at how the parent perceives the child and attachment indices as well. So we're able to really look at not just how we think our clients are doing or how our clients think that they're doing, which they're a piece of the puzzle, but looking at changes in data on all of these different measures across the time that they're in treatment, and working with the Rutgers School of Social Work in order to be able to really look at patterns and create a complete picture of how our services are helping our clients to meet their goals.
Great, great. And Rachele, we'll come back to you with the question of, as a mom with, and the situation, what are your concerns? What are you, what are you most worried about as the impact on your children?
I think for, it's a little different for each of them. I mean, for my 6-year-old, mostly just, the lack of social interaction. She's been home doing virtual school. We're in Clinton Township, so they do offer a hybrid model. However, it's only to go into school, the hybrid is only 2 half days in the school, and the rest is virtual. So you had the choice to keep the child virtual or do the hybrid. And because it was only 2 half days and we had our son, my husband's been working from home since COVID started, we just decided to keep her all virtual. So she does do some activities. We have her in dance class and like a tumbling class, but it's just not the same. It's not the same at all. She's not getting the same interaction. She's not playing with friends. We really don't have play dates. We have 2 little neighbors next door to us that she plays with sometimes if the weather allows outside. But, that's when I'm concerned for her. I mean, she's a very smart little girl and I think she'll be fine. She seems to be adjusting okay. But I see, I see how she sometimes interacts with us or with other kids where when we are around them and she forgets how to interact with kids. So that's probably my biggest concern. And then for my little guy, I mean, he's small, it's hard to tell. I mean, I think, it's just been a challenge to always have to kind of, keep him home, figure out how I'm going to watch him, my husband's going to watch him. Like, again, I'm being careful. So if I have to run to the supermarket, I'm not taking him with me where I would have. And I think I know how much my daughter loved going to the supermarket with me, for instance. Like, she loved sitting in the cart and looking around, and he's not getting any of that. So I'm a little bit concerned about how those things are gonna be. And I can and then the other thing I just wanted to say briefly was, I think, I don't know if you were going to touch on this, Dennis, but you had said, maybe something that we can take from this or learn from it. And I think, as a mom, just having that time for like self-care is really important, like taking some time for yourself, because I'm definitely around my kids a lot more than I think I would be otherwise. And it can be really stressful. So, just taking time for myself. And I think, as a physical therapist, I know some of these things and know what to do, but it could be anything. It doesn't need to be physical exercise. I mean, I think just anything that you feel like you're taking a time for yourself, even if it's journaling or something like that. But I think as a parent, when you are under so much more stress because your kids are not in their normal, regular routine, just taking time for yourself is, doing something little every day is so important.
You stole your 2-minute wrap up at the end, but that's okay. I'm going to ask any questions at this point. Does anyone have any questions for the group at this point? Anything in particular they'd like to ask? Feel free to come off mute and ask it. All right. Rarely does anyone brave enough to do that. So, Paul, go ahead, sir.
Yeah. So full disclosure, I don't have any kids, right? So it's kind of a moot point for me, but what it did kind of make me think about is, just like you were saying, Rachele, the social impacts of young children who now have this at least a year of time where there is very little social interaction. That just blows my mind. Something I've never had the need to think about, didn't think about. I'm just like, wow. Right. So kind of the long-term implications of things like that.
Yeah, we'll be feeling this for a while, definitely.
Yeah.
So Carolyn, you have your 2 minutes now to wrap up and say whatever you think is important that you really want everyone to know.
Thank you. I think something that is worth considering is, and following up with what Rachele said in terms of the impact of stress, that stress affects the relationship between mom and baby, even during pregnancy. So we see infants who are born where during gestation, mom was exposed to large amounts of stress. We know from studies that infants are aware of the mother's emotional state while they are gestating, and that infants who are born to mothers in high stress environments are born with larger, more reactive amygdalas. So that's the part of the brain that activates that flight response that's impulsive, that responds to emotionality, and smaller, less developed cerebral cortices. So infants who are gestating during this time are being born with a changed brain structure. And then they are born into a relationship with a mother who is very much impacted herself by the stress, as Rachele mentioned. For the clients at START and the Center for Great Expectations, they are already very under-resourced. They have trauma histories. They are using substances as coping techniques. And so not only is mom impacted, and not only is the child impacted, but that relationship is truly the child's environment. And that relationship, that container for the child's development, is also impacted by the stress of COVID-19.
Wow. Wow. Yeah, no, I mean, so we'll give a chance to come back. Peg, if you want to come back and just real quick say how people who are interested in helping you can help you.
Thank you, Dennis. Yeah, I would urge, anyone that has an interest in learning more about the center to go to our website, which is, pretty comprehensive. And in addition to that, you can donate right on the website, which is offered. And, we're also really excited to invite people back in. I mean, I don't think I've ever had a visitor that came to the center, and Dennis, you can speak to this, but when we talk about, a trauma-informed environment, it's really palpable, at the center. And I think when people can actually touch and feel and see what we do, it really encourages them to get behind the mission and to support us. I mean, we raise about 30% of our annual income, which ends up to be about $1.5 million. So
yeah, no, I can attest that and it's things you don't really think about when you're just running around doing your business stuff and doing what you do, and you get in there and you see what a wonderful and how committed the people are. It's just wonderful. That's why you were the first people I thought of when we were talking about this, and had to have you guys on and had to have you guys talk. So
thank you so much. We're
no
grateful.
problem.